Hello, I am Jenny Nyholm, your mental health outreach coordinator for Tri-County GLAD. Welcome to the June 2016 Community Education blog entitled A Cultural Perspective on Mental Health. Welcome this guest for the Community Education blog on Cultural Perspective on Mental Health. Hello, tell us your name and a bit about yourself. Hello, my name is Dan Prodre. My wife Jean is deaf and I have 2 hearing sons. I work in the Postal Service for about 25 years. Can you share an experience of your cultural perspective associated with mental health from childhood to adulthood? A long time ago in the Philippines, they did not have special education. I tried to speak, but people, especially the children, always laughed at me and thought that my voice was funny. I did not have hearing aids back then, so I moved to America when I was past 10 years old. My mom told the teachers that I had trouble hearing, and my teachers told her that they had special education and support services to improve my speech skills with hearing aids. What symptoms, feelings did you experience being left out of the family conversations or reunions? I felt that the communication was not shared because I could not understand what people were saying. I wish they would inform me. They said later. Sometimes I felt very sad. What strategies did you utilize to alleviate the symptoms? From being left out of the family reunions. I went out for a long walk. Sometimes I watched television. What is your advice on how we can spread the awareness of the cultural perspective from other countries on mental health? My wife noticed I was always quiet at school. She tried to have me to converse with her. She and I began to write notes with each other, and she asked, "Please come visit me at my home." We eventually shared and communicated with each other. I told her that I could not communicate but was willing to visit with her. I then learned to communicate in her language, that was sign language. Sign language, and I learned to interact with deaf people. I felt so different. What is cultural perspective? Cultural perspective refers to an internal set meanings, values, norms, habits, and identities that a cultural group from other countries belong to. Cultural influences on how a family views mental wellness and dealing with the associated challenges. What is mental health? World Health Organization, WHO.int, August 2014 defines mental health as a state of well-being in which every individual realizes his or her own potential and can cope with the normal stress of life, can work productively and fruitfully. and is able to make a contribution to her or his community. Mental health is an important part of a person's overall well-being. Cultural groups may share a relational collectivist worldview. Where they put others' needs in a family group or community first and foremost. Cultural differences may impact a person and his or her family and the attitude and the ability to understand, manage, and cope with the mental health issues. They bring cultural ideas and values in responding to the mental health system and the expectations and consequences as well. WHO 2014 reveals a fact that misunderstanding and discrimination against people and their families prevent them from seeking mental health care. National Alliance on Mental Illness, NAMI, points out the diverse cultural communities face many barriers, such as higher levels of stigma, misinformation, about mental health and language that prevent them from receiving care. In order to find support or care for the person with the cultural background and mental health needs, it is important to seek a right professional with cultural competence to work effectively with this person. Thank you for sharing with us on your experiences with the cultural perspectives on mental health. Thank you, Jenny.